listening to the LOZ Podcast Network.
Hello, everyone. Welcome back to the LOZ Podcast Network. You might be watching us in the LOZ app. You might be listening to us on KRMS radio on Saturday mornings from 10 to 11. We do simulcast now in both the app and on KRMS, so you get double the feed of the LOZ Podcast Network. My name's Ken Lawler, and happy to be with you today. And I have a really super friend and guest on today, Kira Moneg with Lakeside Care Clinic. Kira, how are you doing?
I'm doing well today. How are you doing, Ken?
Awesome. So listen, I mean, we're in flu season, right? I mean, this is like, people are feeling it. Every time I talk to somebody, now that the kids are back in school and all the stuff going on, the holiday stuff, I mean, everybody's passing germs back and forth, aren't they?
Oh, yeah. It is just a public petri dish out there right now.
How are you guys? Are you seeing a real influx in people coming into the clinic?
We are. Yes. We have been very, very busy on the walk-in side of things. Fortunately, we have two sides of the clinic. So we are able to kind of keep all of the sick people on one side and all of the well people on the other side. So that's
good separation of church and state there. We appreciate that. Those of us who aren't sick. And it's funny because, look, I think we've talked before and we talked about your business model, and it's really built for stuff like this, right? I mean, if you have a family and you have kids and you're out there and you need to get in to see somebody right away, a lot of people, they have to go to an urgent care, which, let's face it, there's not a lot of those around anymore, or the emergency room, which is probably a minimum an $800 bill when you go there. But people can come to Lakeside Care Clinic and they can actually sign up for memberships really reasonably, and they're covered, right?
They are. Yeah, it's all, we don't take insurance. And so, but what that does is it allows me to provide better care, allow for accessibility and quality, really. So yeah, if you're a member, you have an evening, like an after hours number, where if your child's sick, or you're sick and something's going on, you can just call me after hours or on the weekends.
And that's the beauty, is that they don't always have to come in, right? I mean, some of the things can be taken care of just with a video call or on a phone call. So, I mean, I know a lot of us with kids, they're sick, they're in bed, dragging them into the facility. I mean, there's a lot of things you can do over the phone and virtually now, right?
There really is. And honestly, Ken, I think most people, don't realize or forget that so much about an exam is history. It's talking to your patient, getting the history, figuring out the symptoms. How long have they been there? When did they show up? Where have you guys been? Who have you been around? That sort of thing. If the child's at school and strep throat's going to school and now they have a fever and sore throat and all of the things, that it's a lot of it is history, and a lot of things can be diagnosed based on that. So yeah, virtual visits make it very easy and convenient for the family.
I know we, obviously we're members of Lakeside Care Clinic, and I've got a special needs son, Blake, and it's just been a godsend for us to be able to call up and say, look, he's got this going on, or here, I'm going to get on a video call and show you a rash he's got, or it's, something else that's going on, and we can get it taken care of right there. You send in a prescription, we're headed up there to get it, and just getting him into a facility is tough for us because he doesn't really, understand what he's doing or going in there. So, I mean, I know for us it's been amazing, and I know everybody with kids has the same issues, right? Life is tough. Everyone's trying to work and get it done, and so any way you can make it more convenient for them, you guys have really set the mark on going to what's out there now virtually and helping your clients and patients get through that.
That's truly what I've always, kept hearing over and over again in the community. We can't get in anywhere. We can't get in to see our pediatrician. We can't get in to see our primary care. You go to the urgent care and you wait for 3, 4, sometimes 6 hours. And that's accessibility was my primary goal in opening Lakeside Care Clinic. I really wanted people to be able to go somewhere, be seen fairly quickly, make it easy. Healthcare shouldn't be so complex and complicated to just be taken care of.
Well, and let's talk a little bit too about what's going on right now. So obviously, everybody is looking at their healthcare right now. You have the Obamacare has been opened up, so now they're sourcing their healthcare. You've kind of got a different take on this, and I was talking to you the other day, and I think it's really a brilliant thought in that you actually have clients that'll come in, you'll sign them up for your service, for your membership. And then for catastrophic care, you have a couple of avenues they can go to for just that. So basically, they're kind of building their own healthcare program, but to their benefit because they're not paying a huge out-of-pocket cost for everything. Tell us a little bit about that.
Right. Yeah. A lot of people think that their only option is just you go to an insurance agent, you say, okay, well, this is my option. I have to pay $2,000 a month, but it's not. I think there's a lot of other options out there. The primary option being that you become a member with a direct primary care clinic, such as my own Lakeside Care Clinic, and you have your primary care needs met. So anything you need on a primary care level, meaning chronic disease management, if you need your blood pressure managed, your diabetes managed, cholesterol, anything that you take daily medications for, that's what we can do here. We do preventative as much as possible here in the clinic. We do blood work. We can get a lot of your medications for you for, if you're a member, generally $2 to $5 a piece. So it's
Wait,
pretty.
$2 to $5. Is that right? Did you say that right?
Yeah, and that's for usually a 90-day supply. So it's very affordable. Prices, memberships ranging from $45 to $95 a month. Then you combine it with a catastrophic plan. Now, whether that be something that is on like a private, insurance plan, or you do a healthcare sharing program, there's a lot of those out there. A couple of people that I really work closely with, so I can guide and direct individuals on which direction to go to really kind of build your own plan and make it affordable for you and your family.
It's such a cool way to go because I mean, if you're locally here and you want to go to a place where you can get in right away, where you can make sure that if you need to be seen, you can be seen, even if it's virtually, if you can do it that way, and then you're covered on the catastrophic side for the bigger things. And let's face it, you don't want to go without that coverage because it just takes one bad incident to ruin your life if you don't have coverage. I mean, it can, look, people could go in the hospital for 4 days and come out with $100,000 bill. So having that catastrophic care is essential, but it's no longer where you have to have these healthcare programs where you're paying $500 a month per person, because you can get catastrophic care for a lot cheaper than that. And then obviously your memberships are really affordable. Let's talk a little bit about the pricing on your membership. So if I come into your membership, how do you do your memberships? Does everybody pay the same thing, or is it different levels?
It's based on age, levels based on age. So you have 0 to 18 years old, they pay $45 a month. 19, so 45 years old, pays $75 a month. And then anything over 45 pays $95 a month. If you pay for the full year, then you get 10% off. So you're looking at a year for, less than $1,000.
And if you go to one urgent care, it's $500. You go to the emergency room, it's probably $1,000. That's one incident. And by the way, you don't just you do those kind of things too. So if I get a cut or I, bump my head and I need stitches, I can come to you for that as well, right?
Yes, we do suturing, we do fish hook removal, which everyone gets such a kick out of that. And I'm like, people get fish hooks in their fingers all the time. So yeah, we do a lot of wound care. I have splinting. I send people for x-rays. Another misconception is that people think because I don't take insurance that I can't send them orders to go to a specialist or imaging or things like that. But I can refer to anyone else who takes insurance. So maybe they have a big insurance plan. They want to use their insurance. That's fine too. I can send them anywhere. And they make the decision on whether or not they want to use insurance or not. So.
Yeah. And I think that's the beauty of what you have set up over there is that there's every option is open. You're not restricted. I'm not calling you for an appointment and you're telling me it's 6 months out. Generally people can get in within a day, right? I mean, it's very rare that you're pushing people out more than 48 hours over there.
No, I get a little crazy about that. I'm like, no, they're sick. They need to be seen now. Let's do it. And so if nothing else, you're going to get a phone call and we're going to talk it over. And I'm going to determine, can this wait until tomorrow? And if not, then we're going to take care of it today.
And then included in all that as well is you have your vitamin infusions you do, which I'm a big fan of. Before I met you, I'd never done one, and now I think I do one every 2 weeks, and they make me feel great. You have your weight loss, your GLP stuff, and your hormones, and all that kind of stuff that you have going on. So I mean, it is truly, guys, if you're out there and you're looking for a solution, for a healthcare solution, and this is the time of year where everybody's kind of deciding what they're doing, I would highly recommend you go see Kara. You talk through her program, and then she can give you some recommendations on where to go for catastrophic care. And then she also may have some recommendations for things that you weren't looking at, like weight loss or hormone replacement or some of those things that nobody really looks into. They know they're not feeling great, but they don't know what to do about it. And the beauty part about going to you is they're not going to get a 5-minute meeting. You're going to spend the time with them to really uncover what's going on.
Yeah. And I try to pull from natural treatment measures as well as traditional healthcare measures, really just whatever the patient feels comfortable with and whatever avenue they want to take. I try to give them multiple options and then let them make that decision, or we choose together whatever's best for the patient. I do have a lot of people that come in and they just do a one-time visit, just a consultation to learn more about what direct primary care is. What are the options? What are the benefits? What are the pros and cons? And I do that a lot with patients. So I do recommend that if anyone has more questions or anything, they just want to learn more, just call and come in, and I'm happy to sit and talk about all the pros and cons of every situation, really.
Well, guys, it's super easy to get a hold of Kira and Lakeside Care Clinic. You go into the LOZ app, you hit the button for health and wellness, and you hit one more button and you're talking to her right away. It's that easy. One touch. We love having her in the app. We love having her on the podcast. She's a frequent guest, and we just learned so much from you. Thanks for joining us today. And for all of our viewers on the LOZ app and our listeners on KRMS, we loved having these shows, and we're going to bring them to you every week. And Kira, thanks for joining us today on the LOZ Podcast Network.
Thank you for having me, Ken.
All right, guys, we will be right back after these messages.